Welcome. It's good to have you this morning. I am Commissioner Bill Lee, Utah County Commissioner. We are here to talk about significant problems we're facing in Utah County. Addiction to prescription pain medication, also known as opioids, is at an epidemic level here in Utah, including Utah County. For many, addiction begins with a legal prescription. According to Utah Department of Health injury reports, Utah County is one of the top 5 hotspots in the state for emergency department visits due to opioid misuse or overdose. And in cities in the south part, where we're at here, in the south part of the county, including Payson, Santaquin, Salem, and others, the more recent report on opioid overdose death rates has shown there's 27.68 deaths per every 1,000 people in population. That's higher than the state average, and it's higher and the highest rate for many of the small areas in Utah County. This is happening right here in our community. We all need to work together to be part of the solution, and that's one of the reasons why we're here. These concerning trends have mobilized the county's public and private healthcare organizations to deliver a unified public health message to their patients. The goals of this messaging is to encourage Utah County residents to take a more proactive role in their health care by educating the public about the risks associated with prescription opioid misuse and abuse, and promoting a conversation between patient and doctors about opioids and other effective alternatives. Today, we're launching this county-wide Use Only As Directed campaign at 11 different healthcare locations across Utah County. Each facility delivers these prevention messages and skills to community members who are at high risk of opioid misuse. In the video that is playing beside me, you'll see images from all 11 facilities showing the breadth of their education and prevention campaign. These messages have been placed in emergency rooms, same-day surgery lobbies, pharmaceuticals, and mental health treatment facilities across the county. Will you give each community partner a chance? We're going to give each community partner a chance to make a few comments about how they are working to combat the opioid epidemic in our community.
Thank you. I appreciate the opportunity to participate in today's event and talk with you about some of the efforts to reduce opioid use within our Mountain Star facilities. To address this very serious problem, we've developed a multifaceted strategy where we're working to safely manage patients' pains while significantly decreasing the amount of opioids we're using. And we've implemented initiatives here at Mountain View Hospital as well as Timpanogos Regional Hospital that support these efforts. One targeted area that we're really focusing on is the operating room. This is an area where we've developed protocols where we don't have to use just opioids for pain management. We're attacking pain from multiple pathways, and so when patients go home, we're able to decrease the number of opioids that they're prescribed. And it's important to note that for patients, when they're discharged, 42 to 71% of opioids actually go unused. So we want to decrease that quantity and not set them up for potential misuse. And some other important statistics I want to highlight are that for every week that a patient is on an opioid, the risk of abuse goes up about 20%. And for every additional refill that a patient gets, the risk of addiction actually goes up 44%. So we really want to encourage the short-term use of these opioids. We're taking a similar approach in our emergency department where we're really trying to educate patients about alternative pain management methods where we don't have to prescribe opioids. And we're firmly but compassionately redirecting patients with chronic or recurrent pain to their primary care physicians because those are the ones to best prescribe a refill if they do need one. And we are not providing replacement refills in the event that a patient happens to lose their opioid prescription. And overall, what we're really trying to do is change patients' perspectives about pain. There's not all conditions require an opioid, So we want to make sure that we get that message out that acetaminophen or ibuprofen can be used just as adequately as an opioid. And then patients, I have a surgeon I work with, he always jokes that, you are going to feel some pain. I'm cutting your belly open with a knife. So we want to make sure that patients realize that they shouldn't expect to be totally pain-free after a surgery or an injury. And while they may have some pain, we will effectively manage that pain. And then lastly, in the event that a patient does suffer from an addiction, here at Mountain View Hospital, we have expert resources to manage these patients and take care of the acute physical and psychological aspects of addiction. And so I just want to say it's a privilege to work with the Utah County Department of Drug and Alcohol Prevention and Treatment in this important effort, and we enthusiastically support this campaign.
With Wasatch Mental Health, we're the community mental health center, and some people may wonder, what has mental health got to do with opioid addiction? There's been research that's recently published in the Washington Post back in June from the University of Michigan and the Dartmouth-Hitchcock Medical Center, which then in their study, they found out that more than 51% of folks that have anxiety and depression are the ones being prescribed the opiate medications, which is a short-term fix. It can help for part of it, but it's not a long-term solution to the problem of anxiety and depression. And so part of with Wasatch Mental Health, we want to be able to promote, there's other treatments that are benefit. We also do a dual diagnosis with Utah County Substance Abuse Mental Health. So we do with them to help with our co-occurring disorders individuals that deal with different types of mental health issues and also deals with substance abuse. We are, again, part of what we do is provide services throughout the community, in schools, in homes, with our 24-hour crisis line, to be able to help those individuals that are suffering from anxiety and depression and need the treatment they need to have. The other part is with mental health is to be able to provide resources that people know where to go. We want people to know that they can call our crisis line for questions and for answers and be able to wonder, what can I do? How do I help a loved one? What do I need to do before they get into the abuse of the opiates? Because most people may not understand that there is treatment, and treatment does work, because our focus is recovery. And recovery isn't just a linear line that goes straight, that people have up and downs in this recovery process, and to help them be able to along that way to work with it. So we provide treatment not only for kids, teenagers, adults, but the whole gamut of individuals to help them to deal with what's going on with the anxiety and depression that they may have, which is a strong indicator that they have, especially with school and with jobs, especially in our day and age, with electronics and social media, becomes issues that go on. So part of why we support this is that we want people to get the appropriate treatment. We want people to get the resources they need. We want them to understand that having the anxiety and depression, there is resources, there is recovery that can happen. And I thank you for being part, not just be part of it.
Good afternoon. Let me start by thanking Utah County for putting on this important event, and also Mountain Star for hosting us. It's great to work with community partners together to address this, as this is a community problem. And we're excited to partner with the Use Only as Directed campaign as Intermountain Healthcare. You'll find this messaging in all of our facilities in Utah County, that is Utah Valley Hospital, Orem Community Hospital, American Fork Hospital, Payson Clinic, and Springville Clinic. The messages that you see in this hospital today and in the other 10 facilities participating that are portrayed in these videos are aimed at raising awareness of the dangers associated with prescription opioids, and just as importantly, to empower patients and physicians to have conversations about medications and treatment plans. You'll notice that inside the hospital elevator doors is a list of questions that I hope everyone will stop and read. These questions are very important as you engage with your healthcare provider on how to manage your pain. In addition to this campaign, Intermountain and our community partners are dedicated to appropriately limiting prescription opioids. Our goal is to reduce the number of acute tablets prescribed for pain by 40%. This is an astonishing number, more than 5 million tablets annually. We are raising awareness among our caregivers on best practices and effective alternative pain management strategies. These medications can be a powerful healing tool, but they also can be quite dangerous, as we know. Our goal seeks to ensure patients receive the number of tablets they actually need while eliminating extra and unneeded tablets that may end up being misused. Part of this process is surveying patients after they leave the hospital to ask how much medication they actually needed to control their pain. I recently had a procedure and ended up with almost half a bottle of leftover meds. This is helping us determine better prescribing practices and is to set system-wide standards for these procedures. Most surgery patients use only half the opioids they are prescribed, and only a small fraction of those surveyed are safely disposing of these leftover pills. That's an important element. As I look over this audience, I know some of you, and some of you have lost loved ones as a result of having extra drugs laying in a medicine cabinet. And it's important to appropriately dispose of that. It's not only important, it's our responsibility. And so we are deeply sympathetic to those patients who suffer from chronic pain, and we know there are evidence-based best practices to opioid prescribing. To that end, Intermountain has developed a class entitled Live Well with Chronic Pain. We hope this class will align expectations and provide real solutions. We are excited to share that these efforts are making an impact. I think earlier Commissioner Lee described some of the challenges we have here in Utah, but by working as a community, all of us, all the health systems, clinics, pharmacies, everyone working together, Utah drug overdose deaths are down 10%, which is a dramatic change in the country. According to the CDC, Utah is one of only 9 states to see a decline in opioid overdose deaths since February, last February, that is. We're excited about this momentum, and we're gaining we're gaining an education for our patients and caregivers about the dangers of overprescribing opioids. However, the end goal is 0 deaths, and that is why messages like the ones we're here today to support are so important for the community. We want to acknowledge and express gratitude for the efforts of our partners across the state, both public and private, law enforcement, Mountain Star, everyone involved, who are our treatment partners. We are committed to continue our collaboration with critical public health on this critical public health issue, to leading out in our sphere of influence as a hospital and as caregivers that will help us live our healthiest lives possible.
Thank you, Kevin. My name is Heather Lewis, and I am the Prevention Program Manager with the Department of Drug and Alcohol Prevention and Treatment with Utah County. And I appreciate the personalization of this because it's more than statistics, it's more than numbers, it's lives that are being lost, and people that we love and that we care about are suffering because of this disease. And the only way that we are really going to combat it is to get upstream, to get ahead of it with prevention. So we've got to curb the devastating effects of the addiction in our community. We have to get ahead of it, and the way that we do that is through community outreach and mobilization, through the things that we've done so far, like installation of the drop boxes, prescription drop boxes, the drug take-back events, naloxone training and distribution, providing safe use and disposal messaging like you're seeing in the messaging here, and then advocating for local and state policies that support prevention in our state. People seem to have the misperception that addiction happens as a result of drug-seeking behavior. But the truth is that addiction can happen to anyone. You go to the dentist and you have dental work done, you have a surgery, you have an acute injury, it could happen to you. So in a recent study of people who used opiates for at least 3 months to treat pain, get this, 50% of them were still using those opioid medications 5 years later. Half of those people were still, that's how gripping and deadly this truly is. That just rocked me. And we also need to change we also need to change the public's expectations about how to effectively treat pain, how to manage pain. And as shown in the newest Use Only as Directed TV commercial, not all fails require opioids.
I'm good. I'm good.
So these installations throughout the 11 locations here in Utah County create powerful messages that remind us to dispose of our medications safely, to avoid the misuse and abuse of prescription pain medicine, but it also empowers us to do three things, which are speak out, opt out, and throw out. And the speak out, I think, is maybe the most important to me, because it gives people a chance to ask questions. Talk to your doctor. Maybe there are alternatives that you can use instead of pain medications. And also speak out about addiction. If we don't speak out, it remains a stigma and people don't get the access to treatment that they need. And so we need to not be ashamed. We need to not be afraid if it happens to us or someone in our family. We need to be able to ask for help and not be buried under the shame of addiction. Opt-out refers to making informed decisions, like I said, being able to ask your doctor if there are alternatives possible. Maybe I want to do physical therapy. There are different things that could be explored with your healthcare provider. And then throw out reminds us to safely discard and get rid of medications that are expired or unused, so that we don't have theft or misuse possible. But even with our best prevention efforts, many are still touched by addiction, overdose, and misuse. And we've invited some families from Utah County to come who've been impacted by opiate abuse to attend with us today and support us. So please come up, the family members that have been affected by opioid misuse. These are all members of our community whose lives have been touched and affected by opiates. And it really, truly, honestly could be any one of us. Lana, for example, 4 of her children became addicted to opioids through prescription pain medications. Amber lost a daughter who became addicted to prescription pain medications, and later, because it was easier, resulted in getting heroin and losing her life through an addiction that way. I really applaud you and commend you for coming today and sharing your story and sharing your loved ones with us today. It's very, very powerful. Thank you so much. These faces and stories show us that this is more than just a healthcare issue or a law enforcement issue or a moral failing. This is not a moral failing. Addiction is a disease. Physical dependence can happen in as little as 7 days. Physical dependence can happen in as little as 7 days. That is so frightening. We can mobilize as a community to prevent addiction from developing, but when it does, we need to work together to connect those people to the resources, the treatment that they need. Treatment does work. There are resources available. And then a community problem requires a community solution, so I invite others to step forward and join with us today in promoting this important prevention message. Commissioner Lee.
This is a great group, and a great group of individuals and programs. The Utah County Substance Abuse Program is a fantastic program. They do a wonderful job. I have the opportunity to interact here and there with them. It looks like I need to do a little bit more interacting here and there as we go forward in areas, and they're doing a wonderful job. And I sit on the authority board for Wasatch Mental Health, and so I get to see the good work they do on a regular basis. So, and of course, our hospitals, they do a great job as they help, and they help to heal. I'm sure that's part of their mission, is healing and getting there. So this issue, for us, it's interesting how things surface and they bounce up. It's not a new issue. It's been around a long time, and it continues to be around, but at times it just kind of comes sliding forward in such a way that we take attention to it, and we start to do something. And that's kind of more of my story. Last year, it started to come up more and more and more. We were seeing it on a regular basis, and finally, I decided it's time to act. We got to start doing something with it. We started asking around, what can be done? What should we do? Talking with the state, some of our individuals there at the state, about what should be done. And I put a resolution forward on our county commission agenda, which is a resolution to pursue legal actions against the manufacturers and some of the distributors of opioids. And it's going forward right now, and to give you a kind of a heads up of where it's at, we have, I think it's 9 or 10 national legal law firms that have submitted through an RFP process to come and present to us to where we would select one that would represent Utah County on this issue. And then we would start the dialogue. Now, I know and you know going through the legal process is great. There's a lot of damage that's been done. I think our law enforcement can attest to that, the hospitals, our substance abuse. There's a lot of areas that we can claim that there's damage that's being done and pursue that. But more importantly for me is this kind of dialogue that we're doing right now. Because we have partners here with our doctors and the healthcare providers and others that are trying to find a way, and they're part of the solution. We shouldn't be looking at them as the problem. They're part of the solution. This is the solution that we're trying to get to. And so I wanted to relate just a personal experience from just my background. I've dealt with fire in the past, and I'm sure a lot of you have done the same, fire in one form or the other. I have taken acetylene and oxygen, mixed them together with a spark, and used it appropriately to cut steel. I'm sure some of you have done the same thing. That was appropriate use for that powerful fire to be used in an appropriate way for a building mechanism. And as I look at that also, I have seen the devastation that goes on with wildfires that happen down in Bryan Head, just ripped through that country. And it's devastating, killing animals and trees and everything in its path. It's just fire, again, can be used appropriately, or it can be out of control and it runs just rampant. And then we have, besides just the scarring and the burning and the devastation of life that happens through that, the after effects happen too, because you get the flooding afterwards because the ground becomes hydrophobic and then all the water just runs off all over the place and it causes problems. As I look at this opioid crisis that we're in, and I'll call it a crisis because it is a crisis, I see some similarities with that. When opioids are used appropriately, used as directed, it can be a powerful tool to be used appropriately. But when they run rampant and they'll destroy lives and families, and the wake behind is devastating. And we see them, and how many of us would say, go ahead, let's stand in this big, huge pool of gasoline, let's give you a match and see how long you're gonna last if you wanna strike this or not. I mean, we would never do that, but then why do we leave a half bottle? Hopefully, I'm sure you disposed of yours appropriately, Kevin, but why is it in our cupboards? Why is it sitting there? We lock our guns up, we lock our materials up, we lock our acetylene and oxygens up, we lock all those things away, but yet those are sitting in our cupboards, unprotected. Those are the sparks and the matches that start the fires that are run out of control, that we see the devastation afterwards. Are these families up here, and I feel for them, they're living it. And there's many in my own family. I've seen them work through some of the terrible situations and try to get off the addictions. And so I applaud any of us that will step forward and be engaged in this conversation. It is one that is going to have to be worked through diligence as we go forward and try to find a way, and this is a great start. Use as directed. We will continue to move forward with litigation, and I hope that for the most part, that it sparks the conversations that are needed and necessary in our communities. In Utah County, it's apparent that we are the type of individuals that will try to take it and say, if this is an issue, let's tackle it. Let's go after it. Let's address it, and let's own what it is, not hide from it, and then try to solve it as best we can. so that we can have, you know, the opportunities of life, that we don't see the destruction that it plows through our lives. Thanks to each of you for being here, the community partners who have participated today. We are grateful for your resources and support they have committed to addressing this critical public health issue in Utah County. The Utah County Commission is also dedicated to reducing opioid addiction and fatal overdoses in Utah County. Some of the efforts we are undertaking so far, of course, has been this resolution and the litigation that is going forward, which I mentioned. So thank you again for being here. This is an issue that cannot stop here. It is something that we have to continue to go forward with, and with great partners that we have in our community, with programs and with our hospitals and the doctors and dentists, which Kevin mentioned today, which I never really put down, with the dentists and others. Let's find some solutions. Let's find ways in which we can go forward together and help to solve some of these problems that we see before us. So thank you for being here.